not only happening on your scalp, but hair loss can also occur on your entire body. It is triggered by heredity, hormonal changes, medical conditions or medications. Hair loss can occur in anyone, but more commonly in men. This video presents what causes hair loss and how to treat. What are the causes and risk factors for hair loss? Most common causes of hair loss happen on normal unscarred scalp skin. The medical term for hair loss is alopecia. Most hair loss is not linked to systemic and internal disease or poor diet. Hair may grow thin due to predetermined genetic factors and the aging process. That's why many men and women experience mild physiologic thinning of hair in their 30s or 40s. Other factors such as illness, emotional trauma, protein deprivation due to the strict diet, hormonal changes in pregnancy, puberty and menopause can lead to hair loss. Health conditions also cause hair loss, such as thyroid disease, iron deficiency anemia and secondary syphilis. How do physicians categorize different types of hair loss? There are several ways to classify hair loss. It is necessary to examine the scalp first to identify whether hair loss is caused by physical destruction or loss of hair follicles. If the scalp seems normal with lots of empty hair follicles, it is known as non-scarring hair loss. On the other hand, cicatricial alopecia or loss of hair follicles destroys the follicles permanently. Non-scarring hair loss also occurs in case there is physical or chemical damage to the hair shaft that causes breakage. Sometimes, doing a biopsy of the scalp is necessary to distinguish these conditions. The physician can also pull a thread of hair to examine the appearance of the hair shaft and the percentage of growing hairs. What are some specific treatments for hair loss in men? There are several unproven products claiming to help with hair loss, however, only a few are scientifically proven and FDA approved. Conditioners, vitamins and shampoos claim to help hair growth in unspecified ways. For example, Minoxidil is a popular brand when it comes to promoting hair growth, however, there is no evidence to prove its effectiveness over regular shampoos. Though they are harmless, they can be useless in helping hair grow. To slow down hair loss, there are 4 potentially effective options. Minoxidil, Rogaine. It can be available over the counter without a prescription. It is more effective on the crown and less on the frontal region. Rogaine may not work best in terms of growing hair, but it's better at holding onto what's still there. One of the side effects of Rogaine is that if you mistakenly apply it to the face or neck skin, there might be unwanted hair growth in those areas. Also, you need to apply it once or twice daily, which can be tiring for some men. Finasteride or Propecia. It is FDA approved for men use only who have androgenic hair loss. Finasteride blocks the action of natural hormones in scalp hair follicles to reduce hair loss. Propecia is a lower dose version of Proscar. This helps shrink enlarged prostates when people are middle-aged or older. It is proven that this medication works well on certain types of hair loss and can take 6 to 12 months to be fully effective. It is available by prescription and taken once daily. Notably, it is not for pregnant women. It is best for men who still have hair to retain and want to regrow hair. Topical medications called prostaglandin analogs are now being tested. This can be used for both women and men, however, is not FDA approved for scalp hair loss yet. They are mostly used to enhance eyelashes. In terms of hair growth, it is thought to lengthen the anagen phase, which is an active phase of hair growth. What are some specific treatments for hair loss in women? Treatments for hair loss in women include Minoxidil or Rogaine, hair transplants, hair powder fibers such as Topical, wigs, hair extensions and weaves. Minoxidil, Rogaine, is available over the counter as we just mentioned. Minoxidil can cause a nuisance as it requires applying twice per day. Surgical procedures like hair transplants can also be used to fill in bald or thinned out areas. What vitamins can assist hair growth? A good daily multivitamin containing zinc, vitamin B, folate, iron and calcium is highly recommended. However, they are not proven to create any marked benefits in alopecia. Some studies suggest vitamin D can be helpful for hair loss. Lack of iron and vitamin B12 can be diagnosed via blood tests and treated accordingly. Other vitamins such as biotin are widely promoted for hair growth, however, many of these claims lack scientific ground. Although taking biotin and other supplements for hair may not cause any harm, it is not effective for hair growth. Therefore, when you decide to buy advertised hair regrowth supplements, be cautious. Anecdotal evidence suggests that oral and topical application garlic, onion juice, saw palmetto, coconut oil, apple cider vinegar and pumpkin seed oil may be effective in regrowing hair. Are you suffering from hair loss? What do you do to mitigate the condition? Tell us in the comments section below. Thanks for watching.